Welcome everyone to our Chapter 10 lecture. This is a two-part lecture, and we're talking about the musculoskeletal system, and we're doing it in two separate PowerPoint presentations this time. So our first one's going to cover muscles, and the next one will cover the skeletal system. And together, of course, if we put them together, we comprise a word I just used a moment ago, musculoskeletal. Musculoskeletal system is pertaining to the muscles and the skeleton, and so they work together to perform the functions of movement, heat production, stability that allows us to walk upright and all these sorts of things. So the muscles and the bones work together. The bones provide structure and the muscles provide movement and also structure as well, but they kind of tie it all together. We have a couple of specialties that come along with when we're dealing with muscles, and a lot of them also deal with bones as well. It happens that I am a rad tech and I work in an orthopedic practice. And orthopedics is a branch of medicine concerned with musculoskeletal conditions. Prevention, diagnosis, care, and treatment of all conditions that may deal with bones, joints, ligaments, muscles, and tendons. And we'll be covering all of those words in tonight or today's lecture, whenever you happen to be viewing this. Another specialty we have is an orthopedist, and of course they are practitioners of orthopedics. An orthopedist is a specialist in musculoskeletal conditions. So once again, they are a specialist, and they're almost always a surgeon, and they use both non-surgical and surgical means to treat musculoskeletal conditions. So in their basic premise, when you go see an orthopedist, you're likely, well, not likely, but there's a chance you're going to end up in surgery because you've had a problem that's developed to the point that now a specialist has to look at it. There's always an axiom in medicine I was taught a long time ago: don't go see a surgeon unless you're ready for surgery. So that should not scare you away from seeing an orthopedist, but do be aware that they are surgeons, and sometimes solutions can be arrived at before surgery. Surgery should be the last stop on the ride, not necessarily the first stop. And one of those non-invasive methods of treating orthopedic conditions is physical therapy, which is abbreviated PT. And this is really where the journey should start. This is about the treatment of disease, injury, or deformity using physical methods such as massage, heat treatment, exercise, and it's an alternative to drugs or surgery. And once again, this should be the first thing that comes out with most situations in dealing with orthopedic problems or pathologies. And it usually is. The thing about it is that often PT is ordered before the patient sees an orthopedist. So generally, by the time they've seen the orthopedist, they've been down this road and the problem hasn't been resolved, or a new problem has arisen as a result of the original problem. So PT is usually the starting point. If you have not seen a physical therapist and you go to see an orthopedist, that's likely where they're going to start, depending, of course, on how severe the injury is. If you've had a broken joint or a broken bone, they're going to work on it from their end. And not all of these things, once again, will end in surgery, but surgery is a primary option in the practice of orthopedics. Here you see all the muscles in the body, or at least the superficial ones, the top layer. You do not need to learn these. We're just putting this in here so you have an idea of what the overview is. When you get to doing anatomy, especially, and aspects of physio, you'll be covering this information in greater detail. So muscles have four primary functions: movement, posture, stability, and one we don't often think of, heat production. But of course, they do produce heat, and any type of movement produces heat. If you've studied the basic tenets of chemistry, you know that. It's one of the reasons, for instance, when we're cold, we shiver, and if you rub your arms or rub your legs, you can generate heat. That friction will help heat production, but also movement. So if it's really cold outside and you go for a run, you can get warm and actually break a sweat, even though the air around you is cool, because you're producing heat. So these are the four primary functions of muscles. One of the main characteristics of muscles is that they have the ability to contract. So muscles can contract; they can't expand. So a muscle can pull something to itself, but it can't push it away. In order to push it away, an opposite muscle has to do the work. And this is when we say muscles work in pairs. When one contracts, the other relaxes. And this example is probably the most basic and primary one we use to explain this concept. If you look at the arm, and in the lower one where the arm is extended, you'll see that the bicep, which is on the anterior portion of the arm, is relaxed. And you'll see that the contraction is happening in the triceps and the posterior part of the arm. So if you want to move the arm closer to your body, something called adduction, you would bring your arm up. As you bring the arm up, the tricep isn't pushing your arm up. The bicep is pulling the arm up. The tricep is relaxing, as you see in the second picture. If you want to reverse that movement and extend the arm again, the bicep will relax and the tricep will do the work, as in the first picture. So muscles always work in pairs, and you should consider this when you're doing simple movements like walking or riding a bike, and think about what muscles might be moving in opposite directions to allow this movement. This is a tricky concept to get, and I'm not here to teach you that concept, but I want you to understand it, because when you do study anatomy and physio, this is going to be a big part of it, muscle movement. And the concept of them working in pairs is a really important concept to understanding how muscles work. There are three types of muscle cells. There are cardiac, skeletal, and smooth muscle. Now, we've talked about these other ones before. Cardiac is specifically the heart. You will not find cardiac muscle tissue anywhere else in the body except for the heart. And if we jump down to number 3, smooth muscle cells are usually part of the respiratory and GI tract, so they're kind of specific to that. The types of muscles we're really talking about in this chapter, and the types that are associated with the skeleton, are called skeletal muscles, and they're the ones that are really responsible for the movement of our body, so the macro and micro movements that our bodies can make. I just sort of covered all this, and you've seen the slide before. Cardiac is involuntary. It makes up the myocardium of the heart wall and is responsible for the heart's pumping action. Now we know that. We can set that aside because that belonged to cardiology, not to this chapter. Skeletal muscle is really kind of what we're focusing on right here. These are voluntary muscles, which means you can use them at your own will. You cannot control your heartbeat. You can't start it or stop it by thinking, but you certainly can use your mind to control your arm to reach out and pick up something. You can make that decision to use the muscles in their intended form to reach out and do something. You see your phone sitting there and you want to look something up or check emails, you can reach out and grab it. You can voluntarily do it. That's a lot different than your heart muscle, and it's a lot different than the smooth muscle of the GI and respiratory tracts. Skeletal muscles are voluntary, as I said. They're attached to bones. They provide movement. They help us maintain posture, and they provide a large amount of body heat, which is sort of redundant information. We already kind of covered that. The other thing I want you to know about muscles, and I'm just going to go over this briefly because I'm not going to test you on it, but if you look at this diagram here, you can see that we have an outside layer of fascia that holds the muscle together, and inside of that you have bundles of even smaller fascia. And if you go right down into those very small bundles as they come out of that muscle fiber you see there, you can see that the muscle cells themselves are these individual fibers. If you're, and apologies to all vegetarians, but if you're a meat eater and you've ever noticed there's strands of meat, each of those strands are muscles. Those are cell muscles, or muscle cells, pardon me. Those are muscle cells. And so this is the way things are layered. So it starts like a very small fiber, and then those are bundled together in larger fibers and bundled together in larger fibers until you have the whole muscle. If you've ever stood on the Golden Gate Bridge and looked at those massive 9-foot cables they have there, all of those cables started with a single thread-like strand of steel, and more layers were wrapped on until you have all that strength and all that ability to hold all that weight. And your skeletal muscles are made very much the same way. Smooth muscles, as I said, that's the respiratory and digestive tract. We're not dealing with those in this chapter other than just to remind you that they're involuntary. They're the walls of hollow organs, stomach, intestines, and so on. They are the walls of ducts like blood vessels and bronchioles, and they're responsible for peristalsis, which you'll recall are the contracting muscle, the muscles contracting rather in a vessel to try to move things through. So peristalsis is how we move food through our body in the digestive tract. There are, 3 accessory structures associated with muscles. We have fascia, we have tendons, and we have ligaments. So very quickly, so you have a basic understanding, fascia, they're a fibrous membrane that covers, binds, and separates muscles. Tendons connect muscle to bone. So remember, tendon is muscle to bone, and ligaments connect bone to bone. So the ligaments kind of tie the skeleton together. The tendons tie the muscle to the skeleton, and the fascia is a fibrous membrane that covers the muscle and covers the individual layers of muscle, and it helps hold them all together and give them structure. Once again, going back to the meat reference, if you've ever worked with raw chicken, you see those thin fibrous layers of tissue that are kind of there, or on ribs, if you've ever cooked ribs. I'm really sorry, vegetarians. I know that's probably not the most pleasant thing to think about, but that's what fascia is, and that's what it looks like. For those of you who've seen it before, I'm just giving you these examples so you have a comparative analysis to understand what they look like. Now, let's get to some combining forms. Fascio is a combining form for fascia, and fascia simply means band, and that's those structures I've been talking about, that thin layer that covers and holds things together. Fascioplasty is a surgical repair of fascia, and fasciotomy is incision of fascia. Anytime we cut through a muscle, we definitely perform fasciotomy because that's how we get to the center of it. Okay, so another combining form we have for tendons is teno, which once again means tendon. A tenotomy is incision of a tendon, and a tenotome is an instrument used to cut a tendon. And I think I've mentioned this before. We have various scalpels that are used in various types of procedures and surgical procedures dealing with all different aspects of medicine. Tenotome is the way we describe the type of scalpel we're going to use to cut through a tendon, or in other words, very tough fascia. Excuse me for a second, my slide got jammed. There we go. And teno also can be used to describe tenoplasty, which is surgical repair of a tendon. And tendinoplasty is also an accepted form of tendon. So as you can see, when it comes to tendon and those combining forms, we can kind of mix and match. You'll hear all different versions of them used in practice, and you kind of choose whichever one works for you. These suffixes can kind of attach to any one of these combining forms that I've showed you here today. So moving on from there, we're going to go into ligaments. So once again, ligament connects bone to bone. Ligamentus means pertaining to a ligament, and so that's also a term that we use in orthopedics quite a bit. And we're going to talk a little bit about the effect of ligaments and in the aspect of a sprain. So sprain is a trauma to a joint that causes injury to the surrounding ligaments. And you'll recall the ligaments are holding bone together. There's different types and they're graded differently. Here we see a type 3 sprain in this illustration here. So what you're seeing are a couple of the different ligaments that have been damaged, and they're going to require possibly surgical intervention to get them to heal again. Often in this case, if you don't have surgical intervention to repair those ligaments, that can be permanent damage, and it may not be something that, a situation that you want to perpetrate. So in this case, we might need to go to an orthopedist and have surgery done. The ligaments, the types of sprains you can have, I think, range from a 1 to maybe a 7 in severity. And as I said, this illustrates a type 3 in this drawing. A strain, on the other hand, is talking about muscle. So remember, sprain is we're talking about a ligament. Strain, we're talking about trauma to a muscle from overuse or excessive forcible stretch. So maybe you've gone to the gym and lifted more weight, or lifted weight for a longer, prolonged period. It's longer than what you normally would do. And those muscle fibers have become sort of fatigued and tired, and then you've overdone it. You did 1 or 2 movements that were too much, and now you have a strain. So that's going to be a painful experience. The strained muscle cells will kind of pull apart from each other, which is the source of the pain, and they're just going to need some time to heal. So it's going to be, the idea of rest, relaxation, ice, that sort of thing, and heat as indicated. And if it's a severe enough strain, then we get physical therapy involved because they can help fix it. And one of the things we can do also to control is using analgesics. These are drugs that relieve pain, otherwise known as painkillers. They range from children's aspirin up to morphine or OxyContin. So anything in that range can be considered an analgesic. We do know that in the last several years we've had an opioid crisis in the United States. A lot of it is because of the misappropriated use of analgesics, especially in terms of hydrocodone and oxycodone. And they've caused a lot of problems. Medicine's now moving away from it. A lot of research from emergency rooms shows that Tylenol gives just as much pain relief as Vicodin or Percocet or some of those stronger pain relievers that are used that are so often given out. So the trend in emergency rooms and in emergency and urgent care is to move away from using opioids as much as possible, provide them for post-operative and fractures and things like that when it's necessary. But for general analgesics, medicine is moving a lot more towards simple acetaminophen, ibuprofen, and these types of medications which don't have the high addictive factor and are safe for use. My 15 minutes is up here. I'm going to pause this. I'll be right back with you with some more about muscles.